I'm Dr. Jacob Barr, physical therapist and owner of Barr and Associates Physical Therapy in Ormond Beach. And this is Florence and Freddie Flamingo, who will be assisting me with today's video, which is on the topic of balance issues and falls. The Flamingo is the mascot of the Vestibular Disorders Association, and the week of September 12th through the 18th is National Balance Awareness Week. We hope that you find this video informative, and if you have any questions, please feel free to contact us at the information provided at the end of the video. Now, balance issues and or falls can happen to anyone at any time for a variety of issues. 1 in 3 adults over the age of 65 will suffer a fall in a given year. Falls are one of the leading causes of hospital admissions, as well as one of the leading causes of accidental death in adults. 95% of hip fractures occur because of falls, so this is a significant issue. Now, many falls do go underreported because they happen when an individual is by themselves and no one's around, so they didn't have any significant injury and they feel kind of embarrassed that they did have a fall. If you do have a fall, don't feel embarrassed. Please tell somebody, a family member, a friend, or especially one of your medical providers, as this can be a signal that there's something else going on that needs to be addressed, and you don't want to have any future falls because actually having at least one fall can put you at future risk for falls. So you want to get that addressed if possible. Now, within our body, there are 3 main systems that affect our balance: our eyes, our ears, and the rest of our body, our musculoskeletal system. Now, with our eyes, we normally use visual input to send signals to our brain to tell us where we're stepping and if any objects are coming our way that we need to avoid. If we have issues such as cataracts, macular degeneration, being in a dimly lit area, being somewhere at night, or if you're taking a shower and have your eyes closed, if you have a balance issue, that can affect it. With our inner ears, there's fluid normally in our inner ear canals that responds to movement of our head and sends signals to our brain that helps with our balance. If you have an ear infection or certain medications can affect the inner ear, that can throw you off balance. With our musculoskeletal system, any injury that you have, whether it's an ankle sprain, knee arthritis, a back injury, that can disrupt the signals that go to our brain that help to control our balance. If you have another medical condition such as Parkinson's disease or diabetes with neuropathy that changes the sensation in your feet, that can also affect your balance. So as you can see, many things can affect our balance, and out of the things I mentioned, many of those can be addressed and helped with physical therapy. Also, being on medications, 4 or more prescribed medications, can also put you at increased risk for balance. So sometimes you have a medication issue, especially if you're on a new medication, that can cause some balance problems. Now, with physical therapy, how we address a balance issue is, number 1, when you first come in, we do an initial evaluation, comprehensive, for a full hour, get a detailed history of your condition, and then put you through an examination to determine what issues may be affecting your balance. And based on that, we prescribe a treatment plan and a plan of care, which may include the equipment that you're seeing next to me, the Biodex balance system, which we can do testing and training on to help with your balance. If you have a vertigo type issue, we have special video Frenzel goggles that can show us a magnified view of your eye, which can help us determine what's going on with your balance and how to treat it. And also from there we can do various exercises and give you some things to work on at home. The main thing is we want you to be safe and to avoid any future falls. And we don't want you to have a fear of falling, which is legitimate. People can have fallophobia and be afraid to go out and not only do their normal everyday activities, but to enjoy life and do some of their recreational activities. So if you do have a balance problem, or you know someone that has a balance problem, please have it addressed. Approach a medical provider about it, and please know that physical therapy can help. In closing, physical therapy can help your balance issues and can help prevent falls. And just maybe you'll be able to do this.